So this is a project that I did with Surya Kaluri, who is co-hosting this event, and we ran a survey of people who are currently caregivers as well as people who are not caregivers to understand more about the differences in their expectations and preparation. So we ran the survey last fall, late October, and right about when we were expecting the results from the pilot component to come back, my mother fell down the stairs at home, and she broke her hip and her wrist on the same side. So while I was studying caregiving, I actually started becoming a caregiver. And as a result, it really made the research much more real, and I think that explains what the motivation behind this work was to understand the fact that when you enter into caregiving, there are always going to be differences in what you expect and the reality of caregiving. And you can never be fully prepared for what that is going to bring you in terms of your financial preparation, your understanding of policy, and your understanding of the resources that are going to be apparent once you actually start. So here's a little bit more of a formal background. Informal caregiving is becoming more common as our population ages, which we've talked about this morning. So one estimate that I saw from the Bureau of Labor Statistics said that a couple of years ago, adults who were 15 and older who were taking care of adults who are older than them numbered a little over 37 million. This can vary a little bit depending on how you define a caregiver, how you define the relationship between the caregiver and the provider, but that's a pretty large number of adults who are currently experiencing this. There's a lot of ongoing work about caregiving. There has been for several decades. Some of them focus on the health effects both of the caregiver and of the person receiving care. Some of them focus more on kind of traditional labor market effects of participating in caregiving vis-a-vis time you might have to take away from your job. And overall, the research from this has been fairly mixed. Early on, it was quite negative, and there was a lot of emphasis on the fact that becoming a caregiver might be associated with early mortality, might be associated with an earlier decline in your mental and physical health, emotional impacts, and there's been a little bit of reassessment of this lately and shown that there are occasionally some new positive emotional benefits from becoming a caregiver, greater connectedness, greater family benefits, and of course, the role of the local policies that are in effect to support caregiving and to support labor markets and time out of the workforce in general can play a big role in the demographics of who's most affected by having to take time off for caregiving. At the same time, in our local context, the U.S. population is quickly aging, and as a result, we're seeing an increased prevalence of age-related chronic and acute conditions. So dementia, as we've spoken about, related conditions, acute conditions like strokes, broken limbs, cardiovascular events. There's a wide variety of different components of illness that can lead to the onset of caregiving. And those things are not always predictable. So I think it's increasingly important that we understand what people know about what caregiving looks like, and that we understand whether or not people are making steps to prepare for caregiving in advance, or if they're just taking it as it comes. So a little bit of a setup for how we're going to be discussing caregiving. Formal care involves paid professionals. So generally that means someone coming to visit the home, a nurse, a professional caregiver. Someone might have a little bit of a higher level of care and require inpatient care, but formal care requires someone who's professionally licensed in some way and who is being paid for their work. And informal care is the kinds of friends and family type of caregiving that you see when someone is just trying to help out someone they know. The way we think about when someone needs caregiving is through the lenses of activities of daily living. So these are things like being able to walk, being able to feed yourself, being able to get to the bathroom, and the fewer of these ADLs you're able to achieve on your own, the higher level of caregiving you need. Instrumental activities of daily living are a little bit more advanced, things like managing your finances, taking your medication, but if you need more help in that respect, then that also implies a greater need for caregiving. The patchwork for caregiving is immensely complicated. So there are inpatient resources for residential living, there are outpatient or community-based types of caregiving, there are different kinds of facilities, there are different types within those facilities, different types of beds and units within these facilities. There are different types of caregivers who are available in different states, depending whether they're funded by Medicare, Medicaid, some combination of both. The payment models for these vary greatly. They're often too expensive for an individual family to be able to handle on their own. There's often a lot of misconceptions about what Medicare and Medicaid are actually going to cover. So when you're in the position of becoming a caregiver, it can be very difficult to know what kinds of financial coverage are going to be available to support caregiving itself. And in addition to that, the specifics of what form caregiving takes can have a major impact on what resources will be available. So something that's a long-term open-ended commitment, like caring for a dementia patient, will look very different from someone who is temporarily impaired and just needs a specific kind of physical support. All of this adds up to mean that when you're thinking about potentially becoming a caregiver in the future, it's very hard to know what to prepare for and to know what kind of support is going to be available through policy. So what we wanted to do in this paper is to understand what people can predict about their own risks surrounding caregiving. So what do they know about whether or not they're going to become a caregiver? What do they know about what caregiving is going to cost them in terms of time and money? What do they know about the expectations around resources that are going to be available to them? Are they going to be able to count on being able to pay for support? Are they going to be able to count on working together with their family in order to come to joint decisions about care? What kind of steps are they currently taking to become caregivers? Are they setting aside money? Are they potentially moving closer to their families who might be in need of care in the future? Are they thinking about any kind of changes they need to make to the layout of their home? Anything related to that? And do they have any kind of self-assessment of their own and their parents' readiness for the caregiving experience? Do they know what levels of preparation their parents have in terms of documentation, wills, anything related to having a power of attorney in place? We'll get into a little bit of that later, but we'll see how much the people are prepared for actually taking care of their parents. By looking at parental caregiving, it has a kind of a different experience from taking care of an adult child. And as the population ages, it's only going to grow in scope and in size. And it's potentially going to be able to impact retirement saving. If you're taking time out of the workforce, if you're having to cut back on the hours you spend at your job, if you have to move, all of that can cause interruptions to retirement savings. So we fielded a survey of US adults between 40 and 64. They had to have at least one living parent. And we wound up with a sample size of 1,249 people who were weighted according to the US population by race and gender. We asked them if they were currently providing unpaid care to a parent or parent-in-law, and if not, if they were expecting to do so in the future. So we have 543 current caregivers, 381 who say they do expect to be caregivers in the future, and 325 who say they don't expect to be caregivers in the future. And we asked them a parallel set of questions to understand what they knew about caregiving or what they experience as caregivers. So we want to compare what those expectations are, see how accurately people can project forward their caregiving potential, and see how accurate those expectations are around what caregiving is going to look like. Here's a big table of summary stats. I can summarize it by saying that the current and future caregivers actually look pretty similar according to most of the demographics that we asked them about. The non-caregivers look fairly different. They have lower income, they're less likely to be working, they're a little older. So for most of the comparisons in this, I'm going to be only looking at the differences between current and future caregivers, and we'll talk about non-caregivers in some future work. Here's a quick table that shows what people said when we asked them how much caregiving will cost if they're future caregivers, or how much it actually costs if they're current caregivers. So the current and future caregivers were actually reasonably close in terms of what they expected caregiving to cost them in terms of both hours and money. A little bit of a difference in terms of their out-of-pocket costs on the extremes. So the current caregivers were more likely to report small costs than the future caregivers expected. But on the whole, I think this is a fairly reasonable expectation for what the potential cost of caregiving will be. The impacts to caregiving in terms of your finances and unemployment are a little bit of a different story. So here, the light gray are current caregivers, and the dark gray are future caregivers. There's a large mass of future caregivers who are just not sure how much it's going to impact their finances or their employment. And for most of these differences, there are actually variations between whether current or future caregivers think that the impacts are going to be greater. So that creates a little bit of a complex network in terms of understanding whether or not people are accurate in terms of future caregiving assessments. But in general, I would say that the future caregivers are not necessarily accurate when it comes to how much the impacts will affect their work, how much it's going to affect their income, and how much it will affect their retirement savings. Here we asked the future and current caregivers a variety of documents that their parents may or may not have had in place. Financial plans, wills or estates, advance directives. Some of these are more common documents, some of them are more refined, but the aggregate bold shows the statistically significant differences between current and future caregivers, and it shows that the future caregivers tend to overestimate what their parents have, and the current caregivers find that their parents did not have documents that they had, and as a result, that complicated their financial caregiving. I think this is a pretty important slide. So we asked both current and future caregivers a panel of topics around whether or not they were thinking or planning for the following events. And we asked them across a wide variety of different financial topics, how much are you thinking you're planning for this? And current and future caregivers had statistically identical responses for every category except for those related to caregiving. So the current caregivers are much more likely to say they were concerned about the decline or death of a parent, or financing the care of a parent, or making time for the care of a parent, and the future caregivers did not, even though they were the ones who originally said in the survey that they did expect that they would become caregivers in the future. Here's a little bit of a breakout of what happens when caregiving begins as the onset of a crisis. We asked someone who was a current caregiver if caregiving began as a result of a crisis event, and all of the financial impacts, with the exception of delaying debt and changing jobs, were statistically more impactful for those who experienced caregiving as a result of a crisis. So that speaks to the lack of preparation and to the impact that that can have. So overall, caregivers tend to overrate how prepared they are, and current caregivers underrate. Current caregivers expected that their parents were going to be more prepared than they were. So when you combine this with the previous slides about the documents that were available, I think this shows that when someone looks forward to their potential caregiving experience, they underrate and are underprepared for what their parents have in place and for how complicated that's going to make caregiving when it comes time to actually sort through financial documents, sort through healthcare, sort through what kind of coverage their parents have, and understand the impact of caregiving. So I'm about out of time, but we've got, as Norma pointed out, a lot of potential future opportunities for research if I can convince Surya to fund us another survey. So we'll see how well the discussion goes, and that'll impact a lot about whether we're back here next year.